Good morning, everyone. Dr. Parsa Karimi coming at you from our Plainview location. Our other office is in Amityville, Long Island. Today I'm going to talk about our first of many discussions we're going to have about how you can prevent surgery with physical therapy, despite what your MRI or X-rays say. Now, I've had, over my 20 years experience in the field, many patients that have come in and say, my MRI shows this, my X-ray shows that, the doctor says I have this, I have that, all based on what diagnostic tests like X-rays or MRIs show. Many times these diagnoses will have to lead to surgery because there's structural abnormalities, either a torn meniscus or bone-on-bone arthritis. But many times I've seen that I've not had these patients go through surgery because the pain that they actually came in here with had to do with not those things that came up on the MRI or X-ray, but more muscular, which is fantastic news for any patient that has knee pain. Many times patients come in and their doctors have told them, it says bone on bone. And a lot of times when you start discussing why these people started having pain, you'll get things like, well, we went on vacation and we did a lot of walking, and when I came back, my knee hurt. So I went to the doctor, they took X-rays, it showed bone on bone, so then I went and had a knee replacement. That doesn't work that way in terms of osteoarthritis, which is bone on bone. The actual cartilage that's on the surface of the tibia and on the femur start to wear down, exposing raw bone, and that's that bone-on-bone diagnosis. But you don't get that after you go on a vacation and walk for a long time and you come back and all of a sudden all that cartilage is gone. It doesn't work that way. It's a longer process because you start to feel more and more degrading or wearing away of the cartilage, so now you start to get more and more symptoms. So it takes a little bit longer. What mostly I've seen with somebody like that is they did a lot of walking, they strained their muscles, the strained muscles cause knee pain, and now they have knee pain. And although the X-rays might show arthritic changes, which anybody over the age of 60 years old, you're going to have arthritic changes. Sorry, that's just the way it is. You're going to start to have degrading of the cartilage, and you're going to have degeneration, as they call it. So don't ever be shocked when they tell you, oh, you have degenerative joint disease. Yeah, it's just called getting a little bit older. So whether that's really osteoarthritis, you can't just base it on an X-ray. I always tell people, unless it's sticking out of your skin or you're bleeding to death, there's no reason to jump into surgery. Always take your time. And that just comes with experience of patients coming in here and having surgery, and then I discuss all their symptoms of what led them to have surgery, and then we find out maybe you really didn't need it if it was muscular. We'll never know because now it's too late. You've had the surgery, and I don't want to make people feel bad, but then you could always see the regret in their face, and they say, wow, I should have just tried PT first. Now, many patients have tried physical therapy first, and let me tell you a little side note about that. There are many different types of physical therapy practices out there. The philosophies are all different from one practice to the other. Some practices like mine, you have to have a one philosophy under one roof approach. Meaning, if you come in and you see physical therapist John on Monday, Wednesday, and Fridays, his philosophy is not going to be different than physical therapist Diana, who works Tuesday, Thursday, and Saturdays. They have to be consistent. And what is the philosophy of the place? Some places never put their hands on you. They never do what's called a deep tissue myofascial release. They'll move your knee around, they'll play with your kneecap a little bit, and they'll do some joint mobilizations, and they'll stretch you, and they'll have you stretch yourself, and they'll call that their manual part. That's a waste of time. Our place, we do a deep tissue massage, we get to the heart of the issue, which, like I said, many times is muscle, which is because you could work with muscle. You can stretch it, you can massage it, you could strengthen it. And those are the things that primarily cause much of the patient's pain that have come in here, that have gone to other physical therapists, that have gone to doctors, pain management, injections, what have you, everything. Then they come here and I tell them, no, it's just your quadricep muscle, that's all it is. And they look at me like bewildered, like how come the myriad of people that I saw, all the experts, couldn't figure this out? Again, it's the philosophy of how you treat. This is how we treat here. So if you've gone to physical therapy and you've gotten a hot pack and they told you to ride the bike and then they stretched you or they had you stretch yourself and they give you a couple like simple exercises, then they sent you on your way, you might have not had the best type of therapy, all right? And I'm very critical of that because I'm a physical therapist. I don't want a physical therapist that's in the field that's not doing the very best for their patients and then giving us a bad name. And also, their patients are still hurt and they're going into surgery and they think, oh, I did physical therapy, it didn't work. No, you went to a garbage place that doesn't work, doesn't get results. So make sure if you've even gone to physical therapy, if you're not feeling like you're getting anything done, go to another place, shop around a little bit. I know it's laborious, you got to do some work and effort, but it's better than having a knee replacement and finding out that now you got to do the same thing, you got to find a good place because now the stakes are higher because you just have a new knee, you really need the rehab. Another reason why patients coming in, they need possible surgery is a meniscus tear. The doctor said the MRI showed a meniscus tear. There are very simple and accurate ways that you could just discuss with someone to know whether they have a meniscus tear or not. They're very like telltale symptoms and signs of what the person's going through. Number one is their knee might give out. Now, your knee might give out because of pain, because you're trying to use your quadricep muscle, it hurts, so it gives out. But it might give out because of a meniscus tear. When you're going to stand up from a chair, if you feel like you have to kind of like wiggle your knee, you kind of maneuver it a little bit because you feel like it's catching, that's another sign. Another sign is if you're laying on your back or you're trying to lock out your knee, however you're trying to bend it or lock it out, and all of a sudden it's going, all of a sudden it's an abrupt stop. So for instance, if your knee's bending, no pain, and then boom, stops. And it's like a hard stop. That could mean like the meniscus is getting in the way, causing the femur not to be able to glide on the tibia, thigh bone, shin bone, and you get like an immediate stop. Or if somebody's trying to lock out your knee and push down on your knee to lock it out, you feel like a sharp pinch in the front, and it's not muscular, it's like deep in there. Those are the telltale signs. But if you don't have any of those, and if the mechanism of injury, that's the most important thing when someone comes in, I say, how did you start to feel this? And 60 to 70% of the time, people are like, I don't know how the hell it started, I just started having knee pain, or shoulder pain, or hip pain, whatever it is. And that's great because, again, it doesn't show that anything structural happened. For you to tear a meniscus, the meniscus sits, if this is your shin bone, your tibia, the meniscus is like two C, like the letter C, next to each other, that are shock absorbers. And if you have your femur sitting on top of it, if there's a shear force, like if you planted and pivoted or turned, the femur and the pressure might tear the meniscus. All of a sudden the meniscus could flap up. You might have a tear in the meniscus, and it might be a tear that's going this way. It's never jumping up and flapping up into the joint space, causing any kind of pain. And it's torn, but it might have been torn 10 years ago. It's not giving you any problems. It's a little deficiency in the meniscus. It's not perfect, but it's not causing any functional limitations. It's not causing any irritation for you. And you might have a quadricep strain or a hamstring strain or a calf strain causing the knee pain. Now all of a sudden you go get an MRI and whoa, look, you have a meniscus tear, and that meniscus tear, which you may have had 10 years ago, is now being blamed for why you have pain now. That is the number one thing. I'm going to say it again. Patients have degenerative changes at their joint. Maybe they have a little bit of arthritis at their knee. Maybe they have a meniscus tear. They may have all these things, a couple little bone spurs. They may have all these things going on that never cause them any pain. So they might have it for 5-10 years, no pain whatsoever. It's not getting in the way of the joint. It's not causing any problems whatsoever. It may be a problem down the line, especially the degenerative changes where you have the arthritis. But right now, it's not causing any of the pain. The person goes on a long hike. They started working out. They started doing a step aerobics class. They went on a long vacation. They were cleaning out their basement. They're going up and down their stairs, and their knee muscles started to strain, causing their knee pain. And they go to the doctor, and all of a sudden, those degenerative changes that, like I was telling you about, the arthritis and the meniscus tear, now all of a sudden they get blamed as why the person has pain. And now it's important to say, okay, what's the next question? Well, how do you fix it? Well, if it's osteoarthritis bone on bone, I don't care what they tell you about, oh, we're going to use these injections and we're going to regrow the cartilage. Anybody who's telling you that is lying to you. You don't regrow cartilage. Cartilage is there. Your body has made it. You developed it when you were a baby. You were born. All the cells created it. And you can't inject cartilage into you. So if they're telling you, oh, we're going to increase the viscosity of the joint, it's going to make you feel better. Many of my patients have come in, they've gotten all the shots, it's done nothing for them. It might give them temporary relief, it does nothing for them. So if your joint is that far gone, where the cartilage is gone, you literally have bone grinding on bone. And by the way, if you have bone grinding on bone and you're a few feet away from me and you're going into a squat, I can hear it. It's like taking two old pieces of dried out wood, putting them on top of each other and then grinding them. That's what it sounds like. It's not the crackling. People go, oh, my knee cracks, or I get little crickling. It's not that. That's called crepitus. The actual grind of bone on bone is unmistakable. You could absolutely tell it. You could say, yep. And then when the person lays on their back, you take their knee, you start to bend it. It's not a smooth, bending, straightening out. It's like, it just goes like that. It's very, very, a lot of friction, a lot of you can just tell there's no, it's a high amount of friction in there. There's no glide. There's nothing smoothly rubbing on something. It's grinding on each other, even when the person's laying on their back. And I've told many patients that way. I've said, hey, you need a knee replacement. Sorry, physical therapy is not going to help you. I can strengthen you. But physical therapy is not going to fix this. I'm not going to regrow your cartilage. I don't want to lie to you. And many research articles have shown that if you do physical therapy first, prior to having a knee replacement, your outcome after surgery is so much better than if you have no therapy and you just go right in for the knee replacement. So I have no qualms about telling anybody, yeah, you need to have a knee replacement. Like, your joint is gone. I'm not going to sit here and lie to somebody and waste 6 to 12 weeks of their time and tell them, oh yeah, physical therapy is going to help you, when it's not. If it's not, it's not. People often say, well, we'll try physical therapy first, and if it doesn't work, then we'll have surgery. That's incorrect. It's either indicated or it's not. You either need it or you don't. You don't say, oh, well, when they say it's the last resort of what you need to do, you kind of need the surgery or you don't. And you can come in here on your first day and I can say, look, let's do 4 to 6 weeks. Let's kind of strengthen you, preparing you for surgery. So many times patients come in and then the question, like I said, is, well, what do you do about that bone-on-bone arthritis? What do you do about that torn meniscus? Surgery. I'm not gonna repair a meniscus. How am I gonna repair a meniscus? I can maybe pull the tibia, the shin bone away a little bit, maneuver it. There's some maneuvers you can do to cause the flap to not get in there. But after a while, you're going to do something else. You're going to pivot. You're going to turn. You're going to go into a deep squat. It's just going to come right back. So again, I've told people, you need a meniscus repair. You need a meniscus, debridement, where they go in there, they cut away the pieces of the meniscus that's flapping up, causing the disruption of the joint. You need to take care of that. Once you do that, you'll be a little sore from surgery, obviously, but you're going to be fine. And many patients are just that. They're fine after they have the surgery. So it's either indicated or it's not. So I don't agree with this whole, well, let's try physical therapy, and if that doesn't work. If that doesn't work, that means you've misdiagnosed the patient. You've done something wrong. If it doesn't work, it's because you misdiagnosed them from the beginning and said they need therapy when they really just needed surgery. So that's where I stand on that. Many times, again, patients come in and they say, oh, I have inner knee pain, and the doctor took an MRI and he says I have a meniscus tear. Many times that could be a hamstring. Your hamstring attaches right here along with 2 other muscles. Your calf comes up and attaches right in here. So a lot of times it could be muscle, and a lot of times it is muscle. There's a lot of pain in the front of the knee. It hurts when I use the stairs, when I squat down, when I go to sit to stand, when I walk. It's all this thigh muscle here. I can't tell you how many patients I've kept out of the operating room just because I massaged and stretched this muscle. It is so simple, it's almost funny. Like, you could really keep people out of surgery. And I love it when somebody has come in and they say, I've been to 3 other therapists, that my doctors gave me injections, everything, countless co-payment dollars, countless days and weeks of being in pain. And then finally I say, oh, it's just your quad muscle. And we do a little massage, we stretch it, we give you some exercises to calm it down. And the person gets up and they go, wow, I can't believe it. My pain is 50% down on the very first day. Now they have to come in because it's like tuning a piano. When the person comes in, if you ever have a piano and you want to get it tuned, if you don't tune it for, a couple of years, the piano tuner is not going to come in on one day and voila, your piano is back. You got to pull all those strings back, all those chords. You got to try to get them back to the way they were. And it's going to take a while. You might have to come back in a couple of times within a couple of months to kind of get everything back to the way it was supposed to be. Then he'll come in, okay, once every 6 months or once a year, he'll come in and just kind of maintain it. But to get somebody back on track, the musculoskeletal imbalances that somebody might have when they first come in, where one muscle is severely weak or tight, you got to work to get that to be back to normal. So that's what we do in physical therapy. And again, many patients, and the number 2 biggest things that they come in here with is they say, I have bone-on-bone arthritis, and I have a meniscus tear, and that's why I need surgery. Now, if you have an ACL tear, which is a ligament inside the knee, if you're an athlete, if it's torn completely, then yeah, you're going to lose function at the knee. And again, I tell those people, listen, depending on what you're doing in activity-wise, if you're not like a weekend warrior and you're just like somebody like me, I'm 45 years old, I'm just going to work, coming back, I hit the gym, I'm not playing football, I'm not playing sports or anything like that. If I had a torn ACL, maybe I would say, all right, you know what, maybe yeah, maybe no. Somebody who's more sedentary than me might be like, no, I don't need it. I don't exercise, I don't hike, I don't do anything on my knee. I'm good. But it all depends on your lifestyle. You have that discussion with your surgeon. But the therapist's job is to say, look, go talk to your surgeon, decide what you need to do, because physical therapy is not going to regrow an ACL. Physical therapy is not going to regrow a meniscus. We're not going to regrow cartilage. That's all nonsensical things to get people to spend their money. But what we can do and what we do is provide expert care to make sure that we get after the root of the problem. And again, 95% of the time when people come in here, it's muscle. And it's great because you can fix it with all these things here. Little massage, little stretch, and some exercises, targeted exercises. If you've gone to any places, like I said, that put a hot pack on you and they just have you ride a bike and you have actual pain when you're doing the exercises, it's not a good place. Believe me, you need to shop around a little bit. Go to reviews, look on Google reviews, look at different things, ask around, hey, who did you use? People will tell you, and that's the best source of referral that you can get, is another patient telling you what their experience was and what they got. So, again, patients come in all the time. The doctor said I have bone on bone. And they say it like, oh no. And I say, well, what's causing your pain is muscular. Yeah, but the doctor said. I always told one patient once, I said, if you really want to have a knee replacement, go have a knee replacement. They saw off the end of your femur and tibia. They drill into your tibia and your femur. They hammer in with cement, a prosthetic. Then they put on a new joint surface on each side. That, they move your kneecap over to do all this. And now you have a big 10-inch incision on your knee. And hopefully you don't get an infection. Hopefully everything goes through. Hopefully goes well. Hopefully the size of the implant is correct. Hopefully you don't get a blood clot. Hopefully all these things happen. Hopefully you wake up from anesthesia. Why would you put yourself through that? I always treat people when they come in as if it was my mother and father. I want to keep you out of that operating room. I don't know you. You're a patient of mine. I just met you. But I want to keep you out of that operating room. That's my oath that I took when I raised my hand and I said, listen, I'm going to do everything I can for my patient. That's what we do. So doesn't matter how many times you've been told you have osteoarthritis, how many times you've been told, oh, you have a meniscus tear and that's what's causing your pain. Try to seek different physical therapy care to see if it's really that. The mechanism of injury is very important, like I said, to see how it came about, how you started to get the pain. And if it doesn't match up with like a meniscus tear, if it doesn't match up with, oh, there was this like traumatic thing that happened to my knee, and it's just, oh, I just woke up one day and my knee started bothering me, you got to question a little bit, like, what did I do to my knee that I tore a meniscus? If I can't remember what I did to my knee, then maybe the meniscus tear is from years ago and this is from something else. And wouldn't you rather have, before you are in the operating room and you count them back from 10 and as they're giving you the anesthesia, wouldn't you rather say to yourself, I tried everything I could. I've done everything. I did physical therapy. I went to a couple different physical therapists because maybe I didn't think one was good enough. And I am very confident that this is what it is. Wouldn't you rather have that than to just jump right into surgery because somebody sold you on it? Remember, I'm a physical therapist. I'm going to want you to do physical therapy. Unless you're not going to need physical therapy and you're going to need surgery. Go to a surgeon. Some of these surgeons, I've met many great ones. I've worked with many good ones, and I try to continue to work with like the really good doctors that don't push surgery. But a surgeon is going to try to push surgery. Some surgeons don't even give you physical therapy. Some surgeons will actually give you, they'll replace your knee and do a knee replacement, and then the patient will say, should I try therapy? They go, nah, your knee's fine. Knee's fine, okay. The person's not going to weight bear properly on it. Who knows if they're going to get their range of motion back, but because you think you replaced their knee joint, that their muscles are okay, they're going to weight bear properly, their strength's going to be equal, range of motion is going to be equal, flexibility is going to be equal, and that all those things together are going to equal the person walking correctly, having no issues, not having, now hip pain and back pain because they're limping. You think all that's going to happen just because you replaced their knee? It's kind of ignorant. But I've seen that. I mean, it happens few and far between times where patients actually come in and they say, oh, my doctor said I didn't need therapy. Okay. But again, a surgeon is going to do surgery. A therapist is going to want to do physical therapy to try to fix it. But to a certain point where it's not going to work anymore, it's not going to do anything for you, then you're going to need surgery. So always remember, I'm doing a series of, the next we're going to do is the hip or the shoulder. I might choose which one, but stay tuned for it. It's just it's the right thing to do for yourself. It behooves you to do the least amount of damage to your body. And even you think least invasive to most invasive. There's nothing more invasive than sawing the ends of your tibia and femur off, aesthetic, sewing you up after a 10-inch incision. There's nothing more invasive than that. And God forbid what might happen, like I said, with all the things that might happen with surgery. Physical therapy is down here in terms of invasiveness. What are you going to get with PT if you come in here? Some muscle soreness, maybe some bruising from the deep tissue massage. Big deal. It's either less invasive than taking a medication, because the medication might alter your systems, might give you stomach issues, might give you who knows what. I mean, with pharmaceuticals these days, they're great, but every time you see a commercial on TV, you think it's something for depression, and then the guy speaks through all the things that it could cause, death, suicidal thoughts, all these. It's like, I'll just deal with my stomach ache. No thank you. I don't need all the side effects. So it's the least invasive and most effective form of treatment for pain. There's nothing else out there, and I can confidently say that, that's more effective but not as invasive, and it's more beneficial for you. And we're the ones that we are the muscle experts. Physical therapists are the muscle experts. We're the movement experts. Kinesiology is the study of the body movement. There's nothing more. That's the very first course we take after gross anatomy, which is the dissection of the body. The very first thing we do is take kinesiology. We learn exactly how the body moves, what the forces on the body are with every single movement. We break down the walking cycle to see what forces are at each joint during the cycle, to see what might be causing that person's pain. So there's nobody more expert on the human body, on musculoskeletal ailments, than a physical therapist, a good physical therapist. A jokester is going to be able to, that's the guy who's going to be putting you on the hot pack, ride the bike, we'll put some stim on there, the stimulation pads, which is garbage by itself. I have a stimulation machine here, but I use it on patients after they've had a knee replacement and their quad muscle needs to kind of turn on and fire. I put those pads on, and as soon as the person is able to quadriceps set themselves, that means meaning they're able to tighten up their thigh and relax, tighten up their thigh, I don't need the machine anymore. But sometimes you go to these places, and the very first thing, they put the stim on, they put ice on, then they use the ultrasound, which is this deep heat again, which by itself is garbage if you're not following up with a deep tissue massage. So now you think, I'm getting things done here, I'm getting the stim, I'm getting the ultrasound. You're giving a waste of time. That's pretty much it. And a hot pack you could do at home. Muscle is down here in terms of what the problem is. Then you have your subdermal fat tissue, then you have your skin. The hot pack gets about this deep. Doesn't even get down to the problem area. So, you could do that at home. So again, anything you can do at home is, why are you going to a physical therapist paying a high copay? You want to go somewhere where you feel like, I got something done here today. I'm sore, I feel like I got something. The guy dug in, he got into the right spots. I really feel I'm looser. That's how you should be leaving physical therapy. So again, the two main things why people have surgery at the knee, meniscus and osteoarthritis. And again, I've seen maybe on two hands the amount of times somebody's actually had a meniscus tear. And I've been in practice for 20 years. I've been doing this for 21 years. And I've been in the field for over 20 years as a physical therapy aide. So it just doesn't happen as much. And someone that's had true osteoarthritis, it's a little bit more than that, a little bit more than what I can count on two hands, maybe my 2 feet as well. But most of the time when people come in, it is a muscular issue, and it's wonderful to keep them out of the operating room. So if you have any questions at all, please give us a call. You can go to our website, www.pklpt.com. That's pklpt.com. It has both our locations on there. Lots of videos about what our philosophy is, what we do. We are in Plainview, Long Island, in Amityville, Long Island, and we also provide home care physical therapy. So if you have any questions, please reach out to us. On our website, there's something where you can kind of leave comments, and if you want to come in, you do not need a prescription for physical therapy unless you have Medicare, which then you could just see your primary care doctor, get a quick prescription that says, evaluate and treat the knee or the hip or whatever. Otherwise, you don't need physical therapy prescription from a doctor to come in. I forgot to mention the no fault, like if you've been in a car accident or workers' compensation, you do need a prescription and authorization. But those three things, Medicare, no fault, workers' compensation, those are the only ones you need prior authorization and a prescription for. But everything else, you can just give us a call and come right in. It's called the direct access law. So give us a call anytime if you have any questions. Thanks.